To take a deeper look at this, I'm also being joined from the same Abuja studios by a virologist who is also a public health epidemiologist and a member of the West African Network for Tuberculosis, AIDS, and Malaria, Dr. Ekela Ishaku. Dr. Ishaku, thank you once more for coming in. Thank you for your time.
Good evening, Ladi. Thank you, viewers.
The background that Kela has set is to indicate that many of these diseases, but if we just take the big three that are in the committee that you are on, which is tuberculosis, HIV and AIDS, and then malaria, that they are still wreaking havoc as much as anything else, even though COVID-19 is what is in the news.
Absolutely, Ladi. I support Kela's report, and I want to say that when you have the national outlook, you will discover that malaria, TB, and HIV and AIDS accounts for 60% of outpatient visits and 30% of hospital admission. So I agree with you. The issue, so that brings to the national question. Have we neglected other diseases to focus on COVID-19? Why is it that malaria has not gotten the response that COVID-19 got? Why is it that HIV and AIDS and tuberculosis have not gotten the response that COVID-19 has gotten? So I think we need to have a national discourse. We need to come together to fine-tune and to be able to have a unified policy that will have a holistic approach and response to all these infectious diseases. Ladi, we have not talked about Lassa fever. We have not talked about influenza virus. We have not talked about even diarrhea diseases. We have not talked about cholera and the rest. So my take here is this, is that we need to bring in stakeholders. We need to bring partners together and be able to come up with a national unified policy on how we can be able to holistically tackle these infectious diseases. My take, I have written an expert opinion paper note to the National Technical Working Committee. One of the submissions I made is that we must begin to think on how we can come up with a contingency plan to begin to navigate around all these things. So I agree with Kela's report. It is quite valid, and it has actually given a national outlook of the crisis we are in.
At this point, let me point out here, yesterday, the Minister of Health, Dr. Henry, did say that the latest statistics from the National Health Management Information System says that outpatient hospital visits have dropped by 50%, 4 million to 2 million. Antenatal visits by about the same percentage, and skilled birth attendance have dropped by almost the same thing, while immunization services have also dropped by about half. So when we are through with dealing with COVID, hopefully, these other problems, is it possible that they would have become even bigger?
Actually, Ladi, we are going to experience a lot of health crises. We are going to experience issues of drug resistance as a result of HIV and AIDS. We are going to also have multiple drug resistance as a result of relapse cases of TB. We are also going to have high mortality rate as a result of malaria. So what I want our nation to do is to come up with a Nigerian model. We should be able to do what is called personalized health therapy. Ladi, I led a state response rapid team to one of the states in the north central Nigeria. And I can tell you that one of the three of their tertiary healthcare institution was converted to an isolation center. And basically those are HIV and tuberculosis clinic. So my take here is this, that we can begin to see how we can begin to deliver most of these essential services to this patient even at home. Ladi, what stops us from using our Nigerian postal services in delivering of drugs to patients if we have their database? Ladi, what stops us from even having a feedback or collecting samples from this patient in their places and then return it back for them to be tested? What also stops us from also setting up what is called the community COVID-19 COP Marshal. So we must begin to strengthen our primary health care system. So I want to advise the Presidential Task Force to begin to look in this direction. We can actually activate our Nigerian Postal Services to be delivering these essential services, and then begin to do what is called bottom-top approach. Now, the Presidential Task Force has given a great leadership to this regard. So it is time for us to engage the community. And in engaging the community, we must be able to set up what is called the community COVID-19 COP Marshal, so that they can be able to interact with people that need these essential services, and then drugs and other services can be delivered to them. I think that is the way to go. We need to also come up with our own Nigeria model. And I think we need to also shift from the copy and paste approach model and then begin to have our model as a nation. So this is my take on this. We must be able to
Thank you very much, Dr. Ishaku. I'm sorry, we've completely run out. We've run out of our time. I wish we had more time for this. But Dr. Ekele Ishaku, thank you so much for these prescriptions. Dr. Ishaku joined us from our Abuja studios.